Hello, leaders! Welcome back for another learning opportunity on advanced care planning where conversations matter. Advanced care planning is the process of thinking about, talking about, and documenting one's wishes for healthcare. Advanced care planning is not only for patients, it is for everyone. Think about what you would want the medical team to do in the event you were unable to express your wishes. Do not confuse this with personal directive. Although personal directives are part of the advanced care planning process, but it is completely different than an advanced care directive. The best time to start advanced care planning is when the person is physically and mentally well. However, it is never too late to begin planning a person's advanced directives. When planning advanced care, one should think about the values they hold with regard to healthcare. Remember that a person's values and healthcare wishes do change over time. And for this very reason, advanced directives are reviewed periodically to ensure that decisions that are about to be made are exactly what was intended for. Advanced care planning ensures that medical-related wishes are made known and legally documented to bring comfort and peace of mind to an individual and to those who have to make medical decisions on their behalf. So in Alberta, advanced care planning is made legal using two forms. The Goals of Care Designation Order, which is actually a physician-signed order, and the Advanced Care Planning Tracking Record, in which conversations that occur about determining a person's goals of care is recorded. The goals of care is usually referred to as the green sleeve simply because it is kept in a green colored sleeve. Let's take a closer look at what the Goals of Care designation is all about. In a nutshell, the Goals of Care is actually a form that identifies a person's resuscitation level. When I first started nursing in Alberta, that is before the merging of different health regions into the one Alberta Health Services, the resuscitation document was very simple with only 3 options. Because of the increase in complex healthcare needs, the resuscitation levels have also increased from 3 options to 7. So the Goals of Care has 3 main categories. Resuscitative care has 3 subcategories, that is the R1, R2, and R3. The goal for this category is to prolong or preserve life using any medical or surgical equipment. The cheat sheet on the top left corner of this video displays a concise set of interventions for each category. The medical care has 2 subcategories, that is the M1 and M2, and its goal is to cure or manage illnesses by conducting medical tests. Remember, the aim is not to preserve life, but rather to manage symptoms of illnesses. The comfort care has 2 subcategories, that is C1 and C2. The goal here is to keep the individual as comfortable as possible without controlling the underlying illness. This resuscitation level is usually suitable for those who have a life-limiting illness in which keeping them pain-free and comfortable is a priority. So, who can complete a Goals of Care order? Because it is an order, only a physician can fill one out. Are there any restrictions with the time or place where a Goals of Care order can be completed? No, actually. But ideally, it should be completed at a healthcare facility or a doctor's office or at a supportive living or long-term care facility when the physician does his rounds. Now let's look at how a Goals of Care order should be properly completed. The top right corner of the form is where the client's demographics go. So things like their name, date of birth, personal health number, and gender. Usually, a patient's label gets affixed there. Then, there are columns for the date and time of when this order is actually being filled. Physicians tend to forget this field, so if you are the nurse reviewing this form after it's completed, make sure you alert the doc of any missing fields. Next, the physician will check off the box beside the relevant goals of care and initial in the space below. Please note that this is a not so visible section in which it allows the physician to check the box off if this is a temporary order. For example, let's say a patient's current goals of care is an R1 and he is about to have a very complicated surgery and states that in the event he goes into a cardiac arrest at any given point during the surgery, he does not want to be brought back to life. So this is when a temporary goals of care will be signed until the patient returns from surgery. Of course, if this box is checked off, there must be accompanying documentation in the Advanced Care Planning Tracking Record, which we will see in just a bit. The next section has space for the doctor to document any exceptions or things that need clarification. Alternatively, the doctor may just state to refer to the Advanced Care Planning Tracking Record. Then it asks to specify the location at which the goals of care was signed. The second half of the form asks the physician to check all that apply with regard to who was involved in the conversation that led to the decision made. That could be the patient themselves or the legal decision maker, also known as the agent. Physicians typically do not check off the third box unless in rare circumstances where the patient was received into care in an unconscious state and there was no information of an existing agent. The final section asks the healthcare provider to identify if this is the very first goals of care that is being made or a revision of an existing one. As people's healthcare beliefs and values change over time, there are times where they would like to have their goals of care order changed, even if there hasn't been real changes in their physical or mental well-being. At the end of the form, the ordering physician will write his full name, followed by his designation, signature, and the date. The next document we will look at is the Advanced Care Planning Tracking Record. So this form just tracks all the relevant conversations that take place with regard to the goals of care order. In other words, anytime a conversation happens between a patient and a regulated healthcare practitioner, that means any professional who is licensed, that conversation must be recorded on this form. This includes even if there were no changes going to be made to an existing goals of care order. The Advanced Care Planning Tracking Record and the Goals of Care Designation Order are always kept in the green sleeve. Completing this form is actually very simple. The top right corner has space to affix a patient's label or demographic information. Then there are the three columns: the date in which the conversation occurs, the site or attendees, and the summary of the conversation. So in this example, on the 5th of September of 2023, Miss Minnie Mouse's agent, who is Mr. Mickey Mouse, has decided a goals of care of R1 after having the relevant conversation with Dr. John Doe. 1 year later, Minnie's agent has decided to change her goals of care from R1 to R3 after a hip surgery she had at St. Mary's Hospital. Like we had discussed earlier, people's health beliefs and values do change over time, and that is probably what led Minnie's agent to change her goals of care. Leaders, I hope that this video on advanced care planning has helped you with understanding the different resuscitation levels in Alberta. If you have benefited from this video, do not just keep it to yourself. Share it with other nurses whom you know will also benefit. In return, I ask that you like and subscribe this channel so that you will not miss a single video from me. Till we meet again, signing off as the Teaching DOC.